So with September looming and the kids going back to school, I'm sure a lot of our listeners have concerns about their kids' skin and potential breakouts. So I'm joined today by Dr. Naomi Mackle, who is an expert in all things skin. She's going to answer some questions to hopefully put your kids on the route to clear skin. Hi, Dr. Naomi Mackle, how are you?
Well, thank you.
Good. So I suppose the first question that many of our listeners would have are, what are the essential components for back-to-school skincare?
So a skincare routine for back to school needs to be simple but effective. So the basics would be an everyday foaming cleanser and a moisturiser. And if possible, I'd like all teenagers to also wear a sunscreen.
And I think one thing for going back to school that can trigger the breakouts is stress. Is this true? And how can we combat that?
Well, acne is hormonal, but stress can increase the production of cortisol, which can make the hormones unstable. So absolutely, stress does cause acne. Keeping a good, healthy, balanced diet, proper daily skincare routine, drinking water, good sleep routine, these all would help a lot with stress, and that will help the hormones.
Okay, brilliant. And for students who might be partaking in extracurricular activities, would they need to take more precautions when it comes to skincare?
Well, you have two issues there. Children and teenagers who exercise a lot more sweat, and if the sweat is allowed dry onto the skin, it can block the pores, which triggers acne. So a lot of these patients, if they're prone to acne, I would ask them to either take the cleanser with them to school and try and wash their face in between exercise and use an oil-free moisturiser. The other issue, depending on what country in the world you live in, if you are in hot countries, you may need to increase your application of sunscreen. And if you sweat a lot, sometimes a sunscreen can come off. So that's another factor to consider in warmer countries.
Okay, brilliant. And I suppose a lot of parents of daughters and maybe some boys would have concerns about makeup causing the skin to be worse. Is this true? And how can students mitigate this issue when they want to wear makeup but they also want to have clear skin?
Yeah, if you wear makeup and it's not mineralized or non-comedogenic, it will block the pores externally and it will trigger acne. So if you have to wear makeup to school, make sure you look for mineralized brands. These are made up of minerals that allow the skin to breathe. The other issue is, we mentioned exercise. If you wear a lot of makeup and you're sweating a lot in the gym, that's also not good for acne. It will block the pores, increase bacteria. So that should be avoided if possible.
Okay. And I think even talking from personal experience, being a teenager, oily skin is possibly the main concern that most of these students would deal with. What are the best practices for managing oily skin?
So a proper skincare routine, things like salicylic acid, foaming cleanser, niacinamide. We also, in our clinics, we do a Reform Anti-Blemish Kit, which is a 3-step simple routine, but it's designed to control oil production. Also, there's a peel in it to remove sticky skin cells that block the pores. So a proper skincare routine, but if the skin is really oily and it's causing more moderate to severe acne, it might be time to also see the doctor.
Okay, brilliant. And I think a big topic within the skincare industry is sunscreen and the importance of wearing it. And I know myself, there's so many different types of sunscreens on the market. What is your advice on the importance of young people and students wearing sunscreen on a daily basis?
Well, sunscreen prevents aging, it prevents skin cancer, it prevents redness. So everybody should wear a sunscreen, but teenagers, it often isn't their top priority. With parents, healthy habits start early. If you can introduce sunscreen at an early age to children, they're far more likely to continue it in the teenage years. Trying to get a teenager to start wearing acne at 16 or 17 is a lot more difficult. But if the teenager has acne, you have to be very careful on the type of sunscreen you use. You must use mineralized sunscreens. if they use oily sunscreens that block the pores, they'll probably never use it again, which would be a huge mistake.
Okay, brilliant. And I think another thing that I would have kind of heard throughout the years was diet playing a role in causing acne of the skin. Is this something you would consider true, or is it something you come across on a daily basis in your work?
I don't think there's any direct link to diet. The only thing is an unhealthy diet, processed foods, sugary drinks, it will probably cause stress to the body, which might make the hormones unstable. And then if the hormones are unstable, this would cause acne. But I'm not aware of any direct link with diet and acne vulgaris.
Okay. So I think one of the biggest things we see now, especially on TikTok and Instagram Reels, is these like pimple patches and quick fixes for breakouts. And I know a lot of people might not struggle with acne on a consistent basis, but they might say, get a breakout and try like a quick remedy to fix it. Is it possible to have a quick fix when it comes to breakouts, or is it a case of management is key?
Yeah, it's a very good question. We get a lot of emergency calls to the clinic before a DEBS or an important event where somebody has an acne cyst and they're looking for a steroid injection. You can get drugs on prescription from your doctor, like benzoyl peroxide would be very good if a spot comes up. But the most important thing is to have an everyday good skincare routine, because that prevents the breakouts. The emergency fix isn't something I encourage. If you manage your skincare properly with a proper skincare routine, your chances of getting an emergency become far less.
Okay, so these pimple patches are a bit of a myth then, which I suppose would bring me into asking you, what other kind of skincare myths would you be aware of or have heard of that are essentially just myths?
So I've seen people say oily skin doesn't require a moisturiser. I would not agree with that. I would have said oily skin does need a moisturiser, but you need an oil-free moisturiser, and you need to be controlling the oil with your proper skincare, your salicylic acid foaming cleanser, all those other products I mentioned. Other patients think tanning beds will improve the acne. I think the reason for this is they notice in the summer their skin can get better, and in the winter the skin can get worse. But tanning beds are extremely dangerous. They cause premature aging. They absolutely are linked to melanoma skin cancer, so they should be avoided at all costs. I've also seen patients saying there's no difference between, expensive skincare and cheaper skincare. I don't think you need to buy the most expensive brands, but you do need to buy good quality. Some of the ingredients look similar, but some of the cheaper brands, the pH is incorrect, the delivery of the drug into the system is insufficient, so the products don't actually work. So you need to be careful with that. I can't really think of any other myths. But
I think that's enough anyway. I kind of covered a few bases for us, and some of the major ones I would see myself online. You speak a lot about oily acne-prone skin. Are there any products or routines you would specifically recommend for students or for parents of students who are struggling with oily acne-prone skin?
Yeah, I think the thing to understand is acne is hormonal, and the hormones increase the oil. And if the oil is allowed to come out unchecked, it blocks the pores. So you firstly get blackheads, then you start getting whiteheads, pimples, ultimately acne cysts, which will lead to scarring. So you must do a twice daily skincare routine to remove this oil, because if you don't, you're going to get acne. In our dermatology clinics, we sell a Reform Skincare Anti-Blemish Kit. It's a very good basic skincare routine. You also need to restore the skin barrier with an oil-free moisturiser. Sometimes we also add in topical drugs, which are prescription only. And then the more moderate to severe acne might require oral drugs.
And with recommending this skincare routine, should people change your routine based on the season, or just use the same routine year round?
Well, in the summer, sometimes the acne gets better, so they may get away with just a glycolic acid foaming cleanser and an oil-free moisturiser. But in the winter, acne can get worse, so they may need to use a more detailed routine. They might have to add in niacinamide, they may have to add in a home peel. Sometimes the skin also gets dry and flaky during the winter, so we recommend vitamin B5 gel as an anti-inflammatory and always an oil-free moisturiser.
And when it comes to buying these products, like you know as well as me, skincare can be so overpriced sometimes. Are there any kind of budget-friendly skincare options you would recommend for your patients?
Well, I never agree with the cheapest brands. I also very rarely see patients who use cheap brands come into the clinic with good skin. I don't think you have to buy very overpriced skincare, but a good foaming salicylic cleanser will cost in the region of 20 to 30 euros, but it often lasts for 4 to 6 months. So I think for good quality, that isn't an unreasonable price point.
Definitely not, no. And when it comes to students and young people, how would you encourage them to start kind of a healthy habit skincare routine?
I think the parents need to start skincare early. Even young kids washing the skin at night and maybe putting on a moisturiser. And then at the very beginning, maybe 10 and 11, if they start getting small bumps on their skin, introducing something like a mandelic acid cleanser or a gentle glycolic acid cleanser on a daily basis with an oil-free moisturiser, then it becomes a habit. So they do it every day and then they will do it themselves. So usually children are very good. You cannot, as a parent, with the homework and the sports and everything else that's going on, be constantly supervising a child. So I would just introduce a skincare routine, simple but effective, but introduce it early.
And you touched on there about, the parents with the football and the homework and everything. When it comes to, I suppose, a busy morning in a household, getting breakfast done, getting dressed, what is the minimum requirement you would say for someone heading out the door to go to school in terms of managing their skincare? What's the minimum requirement you would have for that?
Something like a daily glycolic acid foaming cleanser with an oil-free moisturiser. Some of the children, I say, buy 2 cleansers, leave one in the shower and one on the sink, because obviously you're using it morning and evening. But you squirt this thing out, you apply it on your face, it takes 1 second, and a moisturiser takes another second. So saying you don't have enough time is really no excuse.
Yeah.
You either want good skin or you don't.
Yeah, nothing in life comes free or easy.
Absolutely.
Yes. And if we have any students or parents of students listening where, you mentioned a lot of ingredients there and different products, if their skin is sensitive, how could they avoid irritating the skin with using these active ingredients?
Well, salicylic acid would be the strongest. Some of the products with sodium lauryl sulfate, if you have eczema or dermatitis or are prone to allergies, sometimes you will be allergic to a product like this. But the most difficult patients are somebody with eczema, but who also has acne. So they still need a cleanser that will exfoliate and remove the oil that's effective. But what they sometimes have to do is use a glycolic acid foaming cleanser, which isn't as strong as salicylic, but is still very effective. But they may have to use a richer moisturiser. We have a product called Intensive Moisturiser, which has anti-inflammatories in it, and it's very hydrating, but it will not block the pores.
Okay, brilliant. And speaking of kind of moisturisers and whatnot, we see a lot online about DIY homemade remedies for skincare. Like, what's your thoughts? What's your stance on that?
Well, you're talking to a doctor, so a doctor is never going to believe home remedies work. Putting toothpaste on your spot or tea tree oil, it can burn the skin. We've had some problems with apple cider vinegar where a patient has applied it on skin of colour and caused quite bad post-inflammatory hyperpigmentation. So my only advice would be just stay safe, be careful, but sometimes you need to get advice from people who know what they're talking about.
Brilliant. And when it comes to exfoliation of the skin, like I know myself, I'd regularly exfoliate, but when you're younger and you're in school, you're a student and you see all this stuff online about exfoliating the skin loads, surely it's not good for the younger skins. And how often would you recommend they exfoliate their skin?
So again, it depends on the age. There's a difference between an 11-year-old with very sensitive skin and a 16-year-old. But on a broad basis, I would recommend twice daily use of an exfoliating foam cleanser. So by that, I mean glycolic acid cleanser or salicylic acid cleanser. Then depending on the severity of the acne, we might recommend a home peel. And sometimes we do recommend that every day, but you only leave it on for a minute or two, and then you always replenish the skin with a good quality moisturiser. And it works very well, and it controls the acne very well.
So what you're saying is give back essentially what you take. When you exfoliate, you must give the skin back some TLC.
I think so, but I also would say twice daily is enough, unless they're exercising severely. And that's the only time I'd say do wash your face again. Especially if you're going to be doing mattress all day, it's not good for acne. We notice a lot of children who play sport all day, they start to get back acne. So if there is a shower available and there's a 4-hour delay between matches, if they could run in and quickly shower, that would be great, but it's not always possible.
It's not always possible. And when it comes to sleep, does sleep affect skin health? And how would you recommend patients improve their sleep hygiene?
So if you don't get enough sleep, it will stress the body. If you stress the body, you can release cortisol, which can increase the hormonal problems that cause acne. Sleep hygiene is keep away from the screens, stop all computers, all video games at least 1 hour before sleep, eat a balanced, healthy diet, drink water. All the normal, healthy principles are true. If the child is playing computer games up until 4 o'clock in the morning, they are going to have dark circles under their eyes, puffy skin. It may trigger acne, so it's all a vicious cycle.
Okay, very interesting. And as a doctor, what are the biggest mistakes you would see students and young people making? I'm sure they come into you on a daily basis, but what are the biggest mistakes they would make when it comes to skincare?
The number one I would see, especially with girls, teenagers, young women, is fake tan. Fake tan causes acne. So if there's anywhere on your skin that you're getting acne, because remember, you can get acne on the face, you can get it on the back, chest, buttocks, do not wear fake tan. It will cause acne. Sleeping with makeup on or not using a proper cleanser at night is a mistake. Wearing sunscreens that are too oily, they can trigger acne. Wearing the incorrect products. A lot of patients are coming into me, they're using hyaluronic acid serum. First of all, you do not need that at 13 or 14 years of age, but also it's far too oily for your skin, so it will trigger acne. You can actually cause acne by using incorrect skincare products. Okay,
Brian, that's something people don't realise, is they can actually be causing it while they're trying to help it by using the wrong skincare.
Yes.
And you know, I'm sure a lot of people watching this are the parents of young teenagers. As a parent, how would you recommend parents help their children and teenagers manage a healthy skincare routine?
Well, you keep it simple. It has to be effective. And as we touched on before, healthy habits start early. So try getting the children involved when they're younger, because they're much more likely to listen to the parent when they're younger than when they're teenagers. Teenagers, they listen to influencers and bloggers and their peers. They don't listen to the parents, and sometimes they don't listen to the doctor.
Yeah, definitely. No, well, I think I have to agree with what Naomi said, and I think anyone who's listening can think that was brilliant advice. Brilliant. Excellent. Okay, well, that rounds up today's podcast. If people have any questions, they can drop a comment in the link below, and we hope you tune in next week.